Explain the relationship between dysphagia and acid reflux disease. Here is my man of few words comment, edema. But that's really the big issue. When you have acid coming up there, you get soft tissue swelling, you get swelling of the laryngopharynx. That swelling causes a lump sensation and the perception that something is stuck. Sometimes there are other things going on, but this is really about tissue swelling, soft tissue swelling, or edema. If you remember the reflux finding score, 6 out of the 8 questions were about tissue swelling. So it's all about swelling and mechanical obstruction. So the finding score is a different story. The RFS has to do with your assessment of what's going on in the larynx. And there are these categories. And again, above 7 is considered diagnostic of laryngopharyngeal reflux. Okay, so this is the slight mustache, right? I guess the lip is here and you have the mustache. It took me so long to realize what they meant by mustache. Okay, so it's a little curve here. You have to do a little sort of artistic license here. I mean, this is irresistible. I want to like pull this up because that airway is narrowed by 1/3, right? So patients with severe reflux disease, they're going to come in, they're going to say, I'm short of breath. Okay, granuloma, granulation tissue. So when there's severe reflux disease, you will get tissue breakdown. And this is a classic intubation granuloma because usually the endotracheal tube is posterior. So this is anterior, this is posterior, esophageal inlet. And you can imagine someone with a hot larynx, untreated, has an endotracheal tube in there. Sometimes it doesn't have to be in that long. And they're going to get pressure on that area. You get tissue breakdown, pressure ulcers, and this should disappear with treatment. However, all this was turned on its head scientifically, first with Rivas and Hunter in 2004, and they said what we have been observing, what Nick and I have been observing, and others doing a lot of this, is that laryngopharyngeal symptoms, specifically hoarseness and cough, better predict the presence of esophageal adenocarcinoma than typical GERD symptoms, right? That's quite a statement.
I'm a perfect example. I tested myself on this, okay? When I have one of my bad reflux events, okay, where I purposely do this. I go to bed late at night after eating all the wrong foods. I go horizontal. A few hours later, my nose is running, and I can't breathe. A lot of nasal irritation. You know what I did? I tested the pH of this clear liquid coming out of my nose because I was curious. And, you know, I tested very, very alkaline. And clear liquid. Just test it, put on the strip. Wow, look how dark green this is. That's how alkaline this is. Then I took another strip and I put it in my mouth. I tested the pH here. This is only about 7. Huh. So therapeutically, the brain is telling the sinuses and the nasal mucosa to secrete a high alkaline concentrate. And what are we supposed to do? We're not supposed to blow it out. We're supposed to sniff it in and swallow it. Let it help coat the mucosa here. Think about the poor hospital-bound patient that has to be fed. They're eating in the wrong position. They're in bed getting a meal placed on their table, their tray.
That's right.
With a glass of orange juice and a big bowl of spaghetti with meat sauce, okay? Think about this. Chocolate pudding and iced tea. as they're eating horizontal. Okay? So
With a little ball of Tabasco on the side.
and I guarantee you that if we looked at at a patient's laryngopharynx prior to being admitted to a hospital stay, whether it's elective or non-elective, okay, and then we examine their laryngopharynx upon discharge, night and day. Night and day. These people are refluxing. So the challenge of the speech pathologist. See what's going on here? When these people are being discharged, why are they coming back? What's the number one reason they come back into a hospital stay after being discharged? Pneumonia, right? Why pneumonia? They got it because they were doing the number one thing that causes reflux, eating horizontally.